Okay, now we're going to talk about the reproductive health. First of all, tell me what is reproduction. Then we talk about the reproduction. What is reproduction according to you? The process in which the parent undergo the some series of changes, cellular changes, and the daughter cell is going to form. This point is clear to you? Okay. So now, a reproductive health, we are actually emphasizing on the some diseases that has to be taken care. So, according to the WHO, what is WHO? World Health Organization. Reproductive health means total well-being. What is that? Total well-being, all aspect of reproduction, that is physical, emotional, and the social should be there. So when you talk about this, then a proper reproductive health. Like what is health definition? You know that well-being of physical, emotional behavior. We just talk in the last lecture. So here also reproductive health, this three aspect has to be there. Okay. Now reproductive health problem and strategies. The moment I say problem, why there be a problem in a reproductive system? Maybe some hormonal changes are there. Some, suppose in case of menstrual is not proper, hormone is changed. Then suppose in women the testosterone increases. So these are the imbalance of the hormone. So can I say that mostly those are the hormone related and some mechanical one? Let's see that. India was among the first countries in the world initiated to program family planning. Why India wants to talk about this? Family planning, overpopulation can be a problem. So that they have to state that a family planning should be there. What happen if the population explosion? If the population is बहुत ज़्यादा हो जाएगा, तो what will be a problem? What are the necessary things are there? We are not able to. Yeah, so it will be a problematic. So reproductive health is in a society forms a crucial part of general health. If the population explosions is there, then for necessary things we have to argue, we have to fight for it. But you can say India and Oman right now. Okay, you know that all the facilities are provided by the Oman government because the population is under control. But in case of India, even if the government wants to do it, they are not able to do it because that much fund is not available. Okay, so improve programs covering. What is that? Improve the programs covering candida reproduction related currently. Now, what is that exactly? Let me take this here and it will be better. Okay. Improve programs covering wider reproduction related areas are currently in the operation under the population name Reproductive and Child Health Care RCH. This can be asked for MCQs kind of thing. So there is a program running on that. Sexual awareness is there, programs are there, right? AIDS awareness programs are there. Everything is done by these things. Now, health and education. Education of the young people and marriage and childbearing during war mature stages of life are important attributes to the reproductive health. Yes or no? See, in classes, we study about the, your classes, we study about the reproduction, right? If there is a problem, then it will be a cause problem to the next generation, right? So we have to take care of these things. तो ये सब कैसे पता चलेगा, ये चीजें कैसे पता चलेंगी? जर्नल अवेयरनेस होना चाहिए। और कैसे करोगे? स्कूल में आप टॉपिक बोल सकते हो, राइट? या फिर आप उनके इन योर सिलेबस दैट शुड बी इंक्लूड, बिकॉज यंग पर्सन इज अंडरस्टैंडिंग दिस, डेफिनेटली वो रिस्पॉन्सिबल सिटीजन हो सकता है आगे जाके, राइट? दैट्स द थिंग ओवर हियर। नाउ मेजर्स टेकन बाय द गवर्नमेंट, गवर्नमेंट ने क्या किया यहाँ पे, तो लेट्स सी। फर्स्ट, through the help of audio visuals and a print media, you have must seen that there are some government channels are there. They run the campaigns, run the ads, even some posters are related to the general awareness. Even family members, close relations are involved in the awareness. Why we need awareness? Why we need awareness? Because we should, if you have the information of particular thing, then only you can act on it. If the doctor know how to treat the disease, but before that he should aware about that which disease is like causing a suffer of the patient, right? Then only वो treatment कर सकता है, definitely. So awareness is there. Sex education was introduced in the schools to private awareness. Sex education is introduced, that is a very important thing, crucial step. What do you mean by sex education? What to do, what not to do, what is problem, what not a problem. Okay, so that is there. Proper information about reproductive organs, adolescence, सबसे बड़ा problem होता है adolescence. The body is under changes, है ना? Adolescence क्या होता है? Male reproductive hormone, female reproductive things क्या होता है? Develop होती है. If they starting at developing, definitely there is a hormonal change in the body. Sometime in this like 13 to 16 age is this area where actually the जो पूरा बोलते हैं ना इंसान के morals बनते हैं, या फिर वो खुद को कंट्रोल नहीं कर पाया तो क्राइम भी कर सकता है. इट्स टोटली डिपेंड ऑन दिस. देन रिलेटेड चेंजेस, सेफ एंड हाइजीन सेक्सुअल प्रैक्टिसेस, सेक्सुअल ट्रांसमिट डिसीज लाइक एड्स एंड ऑल अवेयरनेस होना चाहिए. एड्स हो गया, सिफिलिस हो गया, राइट. नाउ amniocentesis. What is amniocentesis? It is a technique used to find out a chromosomal abnormalities in a developing embryo by using amniotic fluid. What is this actually? Suppose the baby, see, to kill the baby inside the fetus is a crime, but sometimes baby is growing with some abnormalities. How you understood that? It will be in a mother womb. ठीक है, mother womb में baby रहेगा, right? So the baby is the one who get the food from the mother itself, but वो excretion तो करेगा. He will do the excretion. Where he do the excretion? In the amniotic fluid. Amniotic fluid is nothing but a shock absorber for the baby, because sometimes you heard that baby गोल घूमता है, या फिर baby the moment of baby inside the mother womb, baby ने लात मार दिया, right? ऐसे सब सुना रहेगा. वो लात नहीं मारता, change the positions. Okay, because amniotic lock cord is there to give the embryonic cord is there for what? Giving the food and all, right? So, yeah, if you take a sample of the amniotic fluid and research on it, you will find, because skin cells shed off होंगे बेबी से, या फिर अगर यूरिनेशन कर रहा है समथिंग, कुछ सेल will be there, part of the cell. So if you take a sample of amniotic fluid and you study the chromosomal amniotic. If you find the fetus, the doctor finds if the fetus is not fit for the future one, then the abortion can be done. So that is a safe measure. Instead of having load on the parents, emotionally nobody wants to kill the baby, definitely. But if if the baby is going to create a problem for himself or herself, it will be problematic. So better to take a abortion step. Okay. So this is the thing. So kab hoga awareness? When you do the amniocentesis. Please write this in your book. Please write this. This is very, very important. Amniocentesis. It is a technique used to find a chromosomal abnormalities in a developing embryo by using amniotic fluid. Where the amniotic fluid found? In the mother womb. What is the function of amniotic fluid? Shock absorber or the giving the proper environment inside the womb. अच्छा, एक क्वेश्चन है. बच्चा रोता है, मदर के वुम में नहीं रोता, जैसे बाहर आएंगे रोगा. रोएगा तो क्या होगा? उसको नहीं रोएंगे तो मारते हैं. यू मस्ट हैव सीन दैट. व्हाई? Because once it cry, the first cry is going to open their lung system, respiratory system. Yes, that's the point. Please write this in your book. Once you're done, we can go ahead. What is that? Amniocentesis. Amniocentesis. Now let's talk about it is misuse. Now see, this is a problematic. We can find the gender of the baby. There are some bad practices. If the fetus is the gender of female, they can be undergo abortion. Like some has a tendency to that. So if they check the fetus sex determination, the based on the chromosomal pattern in the amniotic fluid surrounding the development of embryo. What do you mean by this? What do you exactly mean by this? See, uh, amniotic fluid. What is amniotic fluid? Inside the mother womb, it's amniotic fluid. If you take a sample of that, you can find out what is the chromosomal abnormalities. But obviously, you also find the sex of the fetus. So some has a bad practices. अगर पता चल गया जेंडर फीमेल है तो क्या कर सकते हैं? अबॉर्ट कर सकते हैं, राइट? इट इज प्रॉब्लमेटिक. तो जितना यूज है उतना ही क्या है उसका डिसएडवांटेज भी है. सो दिस इज शुड बी प्रॉपरली अवेयर. दैट्स व्हाई इवन सोनोग्राफी इज बैन, राइट? Very rarely they do to find out the gender, right? Now let's go further and try to understand population explosion and the birth control. Now what is population explosion? What is population explosion according to you? If the population is more uncontrollable and the basic needs are low and demand is more, then a population explosion. So basic needs are not fulfilled. So improve quality of life people. So agar population zyada ho gaya, what going to happen? It's going to create an impact, a bad impact on the resources. Nobody can use the proper resources, right? What is the petrol price over here? Is actually much lesser than the India. Why? That is not on that much load is there. But in India, it's going higher and higher. So can I say that even the basic need get hampered because of the population explosion, right? Even the health, even in Corona, the pandemic was there. In India, there were a lot of very problematic situation there. Worst condition was there. Why? To handle the more people at once, it's very difficult, right? Now, increase the health facilities and better living conditions that is required over there. So let's go further and try to understand. Okay, so explosive impact on explosion of the population. The rapid decline in the gray date rate. Q, what is this happening? See, right now there are so much hospital facilities are there provided by the government. There are so many things. Even the coronaviruses, we hardly take a 6 to 8 months to generate a vaccine. Yes. Now, if the another pandemic is there, you must have seen in the news right now. Another pandemic is about to come, but we are ready with that vaccine earlier. Why? Because the technology is so fast now. So technology fast होने के बाद क्या होगा? Rapid decline in death rate. Right? Age बढ़ रहा है. Person is having some diseases and all, but that can be treated. Yes or no? MMR, maternal mortality rate. What is maternal mortality rate? And IMR, infant mortality rate. The rate of baby are producing and the rate of adults are dying. It is what baby are producing more and adults are not dying. That means what? Population is still there. If baby rate is higher and the death rate is also higher, then it will be balanced. Like suppose they are totally depends on each other. Yes or no? Availability of resources is control or maintained by these two rates. What is that first? Maternal mortality rate. जो है adults वो भी है. And infants, the baby is taking birth and all, right? So along with increase in population of a reproductive age is the main reason for the population explosion. What is reproductive age? In case of male can be produced sperm throughout the life. But in case of female, there is menarche and menopause is there. What is menarche? The starting of the period. Okay, around 12 to 13 years. कभी कभी जल्दी भी आ जाता है. And menopause is the age around 35, sometimes 45 also. So this is the time period or the we can say reproductive period for the female. Okay, so if that is if the in country if the people having this reproductive age is more, time is more, then chances of getting reproduction or chances of getting baby is more. So it will be impact the higher rate of infant. Yes or no? So if in a country if they find this, then there is a population explosion will be there. So this is a indication for the country. Steps to overcome the population explosion. अभी क्या करेंगे? What we can do? Are we Thanos to do this and 50% all the population can be decreased? Thanos का जो idea था वो was good, but is killing the humanity, right? Can we do that? No, definitely. We have to manage the resources according to the population, right? So now in this case, using a various contraceptive method. Why we have to use what is contraceptive? It's not allowing sperm to enter the ova. So there will be no fertilization. There will be no fertilization, no baby will be produced, right? Okay, so reproductive age, they can have this method. Okay, then this is very important. The chapter is very important, very theoretical, but you have to like write the logical answer over there. Educating the people about the demerits of the large family. Yes or no? If they're in family, suppose there is one couple, they have a 7 children, and one couple only one children. Those couple having one children, they can give all the facilities, all the things to the one baby very nicely, and but in case of 7, there is a dissatisfaction between the children's. He's getting, I'm not getting, or something is like that, right? So it will be affecting the quality of life. Yes. So demerits of large family should be awareness should be there. Increasing the marriageable age of a female and male. Increasing the marriageable age. Ideally, reproductive thing is like male become mature, sexually mature little bit later as compared to the we can say female. Okay, so in India there is a 18 years for the female and around 20 years or 22 years for the male to get married, right? Why this age? This age is related to reproductive age, but because of the career, because of the all responsibility, now age is increasing, right? So providing the incentive to the parents having the 1 2 children means what? If you want to control the population, give the facility that if you have 1 or 2 child, government is providing all the facilities. If you have a third child, government is not going to take care of that. So automatically financial result outputs are will be like higher. So family will be controlling 1 2. Okay. Okay. Now, contraceptive. Now, what is contraceptive? Which is not allowing to sperm enter into the, or if the sperm is entering, it kills it. Contraceptive method are used to prevent the unwanted pregnancy. How can you treat the unwanted pregnancy if the sperm is there and ova is there? If they united or fuse, then only the fusion will be occur. If you stop here at the sperm level, then contraceptive is working on the sperm level because ova you can't do anything, but in case of sperm is motile, right? So an ideal contraceptive should be user friendly. How to use, people should know about it. Easily available in a medical shop and all. Effective, yes or no? Yes. And reversible. Reversible means that it will be easy, like it should be like a tablet, right? Then non-side effect, that is more important. Side effect should be not there. No way interferes with the sexual desire and sexual act. The method should be like that. It will be not create any problem with the these things. Otherwise, it is not user friendly. That's why the mechanism is like that. You must have seen some remotes, right? Company gives the, in case of AC, company gives you the best things, but the remote sometimes are not used. Like some give company like remote has to be proper. You're gonna hold it. But what is the use of remote? To control it. But हम क्या देखते हैं, अरे ये तो करना है बस, right? But अगर यही proper हाथ में बैठ जाए तो क्या होगा? स्मूथ। तो सर्विस आर बोथ आर द सेम थिंग। तो आप क्या करोगे, मतलब वो चीज को, प्रोडक्ट को क्या करेंगे, हाई रेटिंग देंगे, यूजर फ्रेंडली बोलोगे, राइट? सिमिलरली कॉन्ट्रासेप्टिव जो चीज है, इफ दे आर यूजर फ्रेंडली एंड नॉन साइड इफेक्ट शुड बी देयर, ये दोनों चीजें सबसे इंपॉर्टेंट है, एंड इजीली अवेलेबल शुड बी देयर, राइट? यस। नाउ contraceptive method should be divided into following categories. What is contraceptive? Not allowing sperm to enter or killing the sperm. That is the thing. Why we only scaling the sperm, not ova? Because sperm is a motile one. Without the sperm, obviously the egg will be unfertilized and that will be menstrual cycle se nikal jayega, right? But we have to cover this topic. Now, natural or traditional methods are there. Barrier methods are there. IUDs are there. Oral contraceptive methods are there. Injectable implants and surgical methods. So we are going to talk about this. This is important question as per the NEET, as per the your syllabus. Okay, so please be aware about this. Now, natural methods, how the natural methods works. They works on the principle of avoiding what? Chances of ovum and sperm meeting. Fusion. So the fusion, they are not allowing the fusion. Please write in a book, natural method includes avoiding of chances of ovum and sperm meeting. It includes periodic abstinence. Okay, what is periodic abstinences? What is menstrual cycle? In a month or particular day, the ladies undergo the menstruation. What is menstruation? The removal of unfertilized egg along with the discharge of we can say uterine linings, right? So ova is coming 1 month one time. So we have to take the maintenance of that. We have to clear it off. So the couple avoid the coitus from the day 10 to 17. What is coitus? Means sexual intercourse. Okay. So 10 to 17. Why 10 to 17? The, see, listen here very carefully. See, as a doctor or as a awareness, you should know. 10 to 17 days. Suppose lady is having the period on a first day. So this 10 to 7 days of menstrual cycle are very crucial in which pregnancy can be happened. So they should not to the coitus of the menstrual cycle as chances of the fertilization. Woman to woman, lady to lady, the menstrual cycle has changes. Okay. So fertilization are very high during this period. So if the question asks when the fertilization chances rate are high in the menstrual cycle, 10 to 17 days. So that time couple should aware about this. Okay. It is called a fertile period. It's called a fertility. So when the fertile is more, 10 to 17 days of the menstrual cycle. Why? Because hormones are there, right? Hormones is there. Now, so in case of fertile period, it's 10 to 17 days. Okay. Now, withdrawal or a coitus interrupts. What is this? Male partner withdraws the penis from the vagina just before the ejaculation. What is ejaculation? Ejaculation in which they contain sperm along with the some enzymes and something which is giving the motility to the sperm. Because sperm has to travel a lot distance to fertilize the ova, right? So interrupt means what? Before the ejaculation, penis should be removed. See, we are now in 12th standard. We should not ashamed to talk about this, right? We are well mature to do this because this is a sex education, right? So we should aware about that. So as a teacher, I'm trying to give my best. What is there in that? Okay. So if you need out, just ask me. Withdraws the penis from the vagina before the ejaculation. So what's going to happen? The sperm entry is restricted. But this is not a proper method. Okay, getting my point? Okay. Now lactational amenorrhea. What is this? This is very important word. Lactational amenorrhea. What is this? Absence of menstruation. If there is an absence of menstruation, means what? There is no menstruation right now. There is no ova in the body of the female. So after the parturition and due to the intense milk feeding and no ovulation in this period, chances of fertilization is nil. Means the female is undergo pregnancy just right. Okay. So obviously she will not have a menstruation until some period. Why? Because body knows, body just have give the birth, female body just have give the birth to the baby. She is not like, see, after delivery, the mother has to be taken care a lot, like feeding and all kind of thing, right? Yes or no? Because he just now not only feeding the herself but also the baby. So they need a proper attention and a time period to get what? A maintenance of our own body. So till that time, progesterone and estrogen levels are not that much. The progesterone is there who avoid the pregnancy. So that period is called lactational amenorrhea. What is amenorrhea? Because of the milk feeding to the baby, milk feeding, which hormones is responsible? Oxytocin and progesterone is responsible. If the level is very high, they avoid the further entry of the ova from the antrum. Is this point clear? Very good. Now in barrier method, what is barrier stopping? Barrier method. Ovum and the sperms are prevented from the physical meeting. They are not allowing to physical meeting. It includes first of all, what? Condom will be there. So used by the male barrier. So this is a very user friendly thing. Okay. Barrier. What is barrier? Ejaculation is there, but the entry is restricted with of this of a rubber or a latex sheet used to cover the penis of vagina and cervix of the female. It also prevents from the STDs. So what is the use of this thing? It's not only avoiding the physical meeting of the gametes, male and female gametes, but also prevent from the STDs, sexual transmitted disease. Okay, so this is the thing. So this method is performed by only male, not by female. Okay, now, but there are condoms of female as well. Okay, but rarely used. But this you are aware about that. Now, diaphragm, cervical. So what are the condoms for the female in this case? In category, you understand that diaphragm, cervical cap, and the walls are there. See, in human reproduction, the male reproductive parts are quite different than the female reproductive. Okay. So in case of male, the condom is a very act like a physical barrier. But in case of female, there are varieties are there. So these are the barriers made of a rubber that is inserted into the female reproductive tract. In case of male, they don't have to insert anywhere. Okay. But in case of female, they tract, which tract? Reproductive tract, right? Before the vagina is there, cervix is there. Cervix is the one which creates the entry towards the thing, right? So what they act like? कैसे act करते हैं ये? Spermicide. What is spermicide? Those who kill the sperms. Those who kill the sperm. There are spermicide creams are there. Jellies. Foams are usually used for along with this barriers. So in case of women or ladies or female, this variety of the condoms are used in case of this. Along with this, they have to use this spermicide because their chances are more. Okay. So increase their contraceptive efficiency. If they're using they have to use these things as well to increase the efficiency. So this is dependent method. But in case of male, that is not dependent method. Okay. Now advantages of barrier method. What are advantages? They are disposable. Okay. They can be self-inserted. No, we don't need anybody help over there. They are reusable. Okay. These are reusable, but in case of male, condoms are not reusable. Okay. Let's go further. Everybody is getting the points? Okay. Now, fourth point, prevent the conception. What is conception? By blocking the entry of sperm to the cervix. What is conceive? Conceive. Conceive karna means what? If the male gametophyte, that is a sperm, and female gametophyte, that is a ova, that is egg, is going to fuse, zygote is going to form. So how do you understand the this fusion has done? Traditional method is that vomiting is coming or some body changes are there, right? So that is a conceive. Conceive means what? The fertilization has been just done and body now undergo the different changes. So conceive is a method. Conceive means what? कहाँ होगा conceive? Through the cervix will be there. So we have to prevent that. In short of physical entry, we are preventing. Now, this is very important things we're going to talk about. It. In NEET, you expect these questions. Intrauterine devices. Intra, inside the uterus. What is uterus? Mother womb will be there. Devices are such a way that they controls the entry or exit. Inserted by the doctor or trained nurse into the female uterus through the vagina. That has to be inserted into the woman body. IUCDs. What is IUCD? Intrauterine devices. May non-medicated. What non-medicated means what? Loop-like structures are there. Mostly is copper used. Copper releasing. Why copper? Because copper is the one act like a spermicide. If you have a microscope, just a sample of sperm, and if you add a copper over there, the sperm will be died, dead because of the presence of copper. So this property of copper we can use as what? We use that. Now you'll tell me, sir, we are drinking water from the copper things. That is useful. But those copper for the sperm is not useful. Getting my point? Okay. So there are varieties, CUT, CU7, multi-load 375. This is the name of that products. Okay. And the hormone releasing iodis. Which hormone? Progest. So can I say that progest, I told you, progesterone in a female body prevents the pregnancy. If the baby is having by the mother, some particular time period is there, progesterone is high in the body, which maintains the milk production, lactation, and along with the no entry for the or OI is not coming, pregnancy is prevented. Similarly, that hormone we can insert it in the female body to make sure उसकी body act करे अरे अभी तो pregnancy चालू है, so they will not secrete any hormone. This is point clear. This is important, whichever I have wrote. Please write. Otherwise, this is in your book, no issue. Now, iodines increase the phagocytosis. What is phagocytosis? To kill some cell. Now, what is undergo the phagocytosis? Sperm. Sperm is killed by the iodines, right? In a uterus, and copper reduce the what is the function of copper? Reduce the motility and fertility of capacity of sperm. Sperm has to be travel a lot. A lot means a lot. Okay. But if the sperm is non-motile, game over there. Why? Mitochondria is not working. So this copper is acting on the motility of a sperm. So who is acting on the motility of sperm in iodine? Copper, which reduce the fertility capacity. Why reduce the fertility capacity? It has a chromosome, it has everything, but he has not. I want to go to home. I don't have a car. Then I'm useless. I need a vehicle. So what is a vehicle over here? Sperm motility. The hormone releasing iodines make the uterus unsuitable for the implantation. Why? If the hormones continuously releasing from that, natural things are getting hampered, right? The cervix hostile to the sperm. What is cervix hostile? Cervix is the place where the entry of vagina will be there. It is the ideal for the female who wants delay the pregnancy and spacing between the two children. There proper should be space between the two children. Why? Because already mother has given the birth. Now their body needs under maintenance and repair. Otherwise, what going to happen? If continuously birth will be there to the child, mother body is not sufficient to give the birth continuously. They need a proper growth and maintenance over there, right? That's the thing. Now oral pills. See, this oral pills is act like a tablets over here. So that is also important. But the problem with the oral pills, when to take, how to take, when not to take. Okay, so this is problem with oral pills. Are a progesterone. Why we need a progesterone? Why we need a progesterone? Let me know. Yes. What is the need of progesterone? Because progesterone is the hormone who avoid the pregnancy. That's why oral contraceptive and oral pills are there. Estrogen combination used by the females in form of tablets. So they inhibit the ovulation and implantation. So progesterone avoid the ovulation, estrogen avoid the implantation as well as the chain. So we can say progesterone, estrogen both are in case of menstrual cycle when you studied in a 10th class something hormones was there. That diagram was there, right? Okay. Cervical mucus prevents the retard entry of the sperm. Administration of the progesterone, if you take the progesterone, or if you take progesterone or the progesterone and combination with estrogen, combination within 72 hours of coitus. If the sexual intercourse is done and the couple knows the semen is just enter into the vagina, that means sperm are there inside. So within 72 hours, because they should not reach above the cervix, right? So within 72 hours, they should take a oral contraceptive. Surgical method. This method is also called a sterilization. What is sterilization? The work, whatever the see, we are sterilizing the sperm mostly, not the ova. Okay, ova is inside. Sperm can be moved. So we sterilization of the it is used as a terminal method. What is terminal method of contraceptive in a female and in a male and female to prevent any more pregnancy? Means suppose the couple having a one baby and they are now don't want anything, don't want any child. So they can undergo the surgical method in which the surgical things is like that they are not going to produce the ova in case of female. In case of male, mostly in who perform that, mostly female perform this. Okay, see what is happen in the male. If there is a male and they perform the surgical method to avoid the pregnancy or not to not to have the sperm, the male surgical method is called vasectomy. It is also found in a male. Now tell me one thing, this is a testis. Inside the testis, there is a formation of the sperm. And this is a vasa differentia, which connects the all, which vasa differentia is nothing but the, we can say channel where the sperm is getting, no, not transported. What is exactly sperm is getting developed. Okay. So if you cut these things, sperm entry is restricted. It's not go away. Okay. This is a surgical method where vasa differentia, we are cutting it. It do not have a problem over here because only the sperm producing, they will not enter into the other thing. That is the thing. But majority vasectomy is not preferred by the male. Only the female do that. Okay. Maybe the male ego, we can say that. Okay. Let's go further. Is this clear? So vasectomy is a surgical method in a male in which vasa differentia are cut surgically. Okay. Now we are moving to the next part, that is tubectomy. What is tubectomy? The moment you say tubectomy, vaso related to vasa differentia. Tube is what? Fallopian tube. Fallopian tube is what? In case of vasectomy, vasa differentia is a area of maturation of the sperm. Fallopian tube is area of fertilization. So can you see that two times perform? Now there is a problem, must be problem in your question should be in your mind. If that is cut, then what is the problem? It is going to harm? No. Whatever the ova is producing, they get degenerated and can be destroyed. So there will be no problem at all. So tubectomy is done in a female reproductive organ. Vasectomy is a surgical method in a male. A small part of the vasa differentia. What is vasa differentia? Area of sperm maturation. Yes or no? Sperm maturation is removed or tie up through the small incision on the scrotum to prevent. What is scrotum? The testes are outside the body because for the spermatogenesis. What is spermatogenesis? The process in which sperms are producing. They need a lesser temperature as compared to the body. So they has to be outside the body. Okay. Tubectomy is a surgical method in a female in which small part of fallopian tube is removed surgically. These techniques are highly effective, but their reversibility is very. Now tell me one thing, if the male performed the vasectomy and now he wants to reproduce, he will, is he? No. Once done, now he's not able to do that. Okay. If the female having one child, she wants to do vasectomy, that is the last decision. That can be reversed back. Okay. So this is the thing. Side effect of the contraceptive. What are the side effects of contraceptive? It is a very important that the selection of the contraceptive method should be taken under the consultation of doctor, because everybody's body is reacting with other drugs with differently. If I have a allergy for paracetamol, you don't have a allergy for the same. Maybe the body, sometimes medicine, sometimes body, the doctors do the observation. They inject over here, they mark the circle or something, they inject something and they observe. If there is a rashes or something, that means you have allergy. Okay. Now they have a ill effect like nausea, abdominal pain, breakthrough bleeding. Why? Because they are avoiding, they are spermicidal, they're going to kill it. Irregular menstrual bleeding, this is very a problem. And even breast cancer. Why breast cancer will be there? Because you're hampering the oxytocin as well as progesterone. Actually, what is the function of oxytocin? If the baby is sucking the nipples, that gives the indication to the brain. Okay, and the oxytocin is actually one who gives the what we can say, the milk is going out. But for the milk production, progesterone is required. Getting my point? Okay. So medical termination of pregnancy. We're taking break right now. We talk about this after 5 minutes. Okay. So let's meet after 5 minutes. Okay, let's talk about the things. Medical termination of pregnancy. It's not abortion. It's something else. So let's talk about exactly what is it. So medical termination of pregnancy means in earlier method we have seen we are working on the hormones. We are stopping it. First, physical barriers are the one who's stopping the entry of the, or we can say fusion of a male gamete and female gamete. They're just avoiding it. Then we talk about the hormonal disturbance. What is that? Progesterone is more, then it's avoided the pregnancy by itself only, right? Similarly, a voluntary termination of pregnancy before full term is called a MTP, medical termination of the pregnancy, or induced abortion. Means what? I told you, in some cases, if the amniotic fluid study has to be done by the doctors, obviously under the consent of the parents, then, if they find some chromosomal disorder or some problem, and the fetus, see, we don't have any right to kill the baby, but for its future, for if it's not properly properly maintained further, so what going to happen in this case? It will be create a problem to the parent. So it's now decision of parent to continue with this fetus or not. It's called a MTP, medical termination. Okay, that is advantage. What is the disadvantage of this? If you know the sex of the fetus, then some people are like, we can't say that, right? They don't want a female fetus, then they can do the pregnancy abortion, right? Now, it plays important role in a decreasing population by aborting a unwanted pregnancy. Huh. That is good thing. But problem is, you know what is the problem. Now in India, MTP is legalized in 1971 with some restriction to prevent its misuse. Misuse bhi ho raha tha, right? Such as, what is the misuse? Indiscriminate and illegal female peticides. Means what? To kill the female fetus. Okay, that is called these things. Now MTP is used to get rid of unwanted pregnancy. What is unwanted pregnancy? Suppose there's a victim undergo the rape. Okay. So if by chance she got pregnant, so definitely she don't want to continue with that, definitely, right? So that time this method is used for abortion. And sometimes by mistakenly also the pregnancies happen, right? So that is also done with a consent. Consent means what? You know that, right? Now, get rights of unwanted pregnancy due to the unprotected or a failure of above methods maybe happen, right? As I told you, oral contraceptive has to be taken 72 hours prior. If she fails to do that, then what going to happen? Pregnancy can be done. So what is the next and last step? Abortion. Okay. Now we are moving to the next part, that is contraceptive use during the coitus or the rape. Rape, you know what is the problem in that? Without the female consent, male is having the like going to give the problem to lady, right? But that time, if the coitus has happened, definitely sperms are going to enter the body. That can't be we can't stop it, right? So that time abortion is the last mode thing. Okay. Now, when a pregnancy continuation could, what is that? When a pregnancy continuation could be harmful or even fatal to the mother or fetus. Sometimes it happens, डॉक्टर आके बात करते हैं हम आपके बच्चे को या फिर माँ को बचा सकते हैं तो who obviously mother has to be taken care first. Some people are like choosing child, so it totally depends on them, because that's why before the surgery they sign the form from the one who take care, right? Or a guidance. When a pregnancy continuation could be harmful for a fetal or mother, so better take a decision. Okay. MTPs are considered relatively safe during the first trimester because the fetus is not that much developed, so they can remove very easily without creating problem to the mother womb up to 12 weeks pregnancy. But after that, they have grown properly. Second trimester MTs are much more riskier. It can be create a problem to mother. Now let's talk about a sexually transmitted disease. Disease or infection which are transmitted to the sexual intercourse are collectively called a STDs or a venereal disease, VD. VD भी बोलते हैं और STDs भी बोलते हैं और reproductive tract infection. This is a problematic. Why? In case of male, the reproduction, we can say reproductive tract infection is very less because urination, entry of, sorry, we can say the यूरिनेशन भी वहीं से हो रहा है और स्पर्म की एंट्री भी वहीं से हो रही है. So urination is more alkaline or as sometimes acidic, so that create a wash to the microbes present. But in case of female, the entry of urination is different and the for the we can say that is different, right? So that major problem is what in case of female. So they may have a more bacterial infection, microbial infection, and during the coitus they can be transmitted. Okay, that is the problem here. So some STDs are gonorrhea, syphilis, genital herpes, chlamydiasis, genital warts, trichomoniasis, hepatitis B, and obviously the AIDS. You should aware about these things. Okay. Now, what is the problematic thing here is this. Hepatitis B and HIV are also transmitted by the sharing injection needles. Like for example, in for the tattoo, or the doctor has a mispractice to use the same syringe to the inject. Suppose the first person having the AIDS, it may be transmitted, right? So instruments with the infected person, transfusion of the blood. What is transfusion of blood? From the blood bank, we get a blood. But suppose the blood bank not identified properly or not store the blood properly, they can transfer the infection as well, right? Expect genital herpes, HIV, hepatitis B are completely curable if detected earlier. If they detected earlier, then only. Otherwise, it will be create a problem. Timely detection and a proper treatment of STDs are very important. Otherwise, it could lead to the complications later, which include the pelvic inflammatory disease. This part is called pelvic girdle, right? Girdle is what? The skeletal muscle part is there. It can create a problem because microbes are keep on growing there, right? So abortions, the birth barriers, ectopic pregnancy, infertility. 1 second, let me do this. We'll read this again. Timely detection is important. If you get early detection, then you can it be curable. Otherwise, there is a complication. Pelvic inflammation should be there, right? Abortion, then stillbirth. What is stillbirth? Baby, which is like fetus, which is just about to grow and has to be taken birth as a child, dead one. Okay, that's stillbirth. Then fertility or even the cancer of the reproductive tract. What is cancer? What is cancer? Uncontrollable proliferation of the cell, which is not controllable. They keep on growing. Now, avoid what are the methods? Avoid the sex with the unknown partners and multiple partners. Unknown partners because we don't know the person is infected or not. Multiple partner, the chances of microbial exchange can be happened, right? Because proper hygiene is not maintained and all kind of thing. Always use the condoms during the coitus. Go to the qualified doctor. Now you don't have to go to qualified doctor. You should know gynecologist. Okay, gynecologist in a case of doubt for early detection and get complete treatment if diagnosed. But what is the problem? Because of the shame, people are not going anywhere. But that is a creating problem to the reproductive health and ultimately reproduction, ultimately population. Correct. So that is the main criteria. They include this chapter in your syllabus. Okay. Now infertility. What is infertility? The sperms are good quality. They can form a fetus very well, like after fusion. But sperm's quality is not that much good. Then the couple may be having a problem from the male side in case of quality of the sperm, from the female side quality of the egg. The lifestyle is going to hamper these things. Yes or no? Yes. So infertile couples can be assisted to have a children through the certain special techniques commonly called assisted reproductive technology. ART was assisted reproductive technology. Please ART full form. This is very important. Now you have seen a majority of the couple undergo this treatment. Why? Because of the lifestyle, because of the stress, because of the not maintained proper hygiene. Sometimes we can create a problem to the quality of the sperm. Okay, let's move further. I hope you're understanding. This is the important thing. Okay, let's go to the last part. In vitro fertilization. This is very, very, very important. And majority of the questions are going to ask from this part. What is in vivo? Inside the body. What is in vitro? Outside the body, fertilization occur. Now the going to implant into the mother womb. So what is happening exactly? Let's see here. In vitro fertilization, that is IVF, fertilization outside the body followed by the embryo transferred, which, why embryo transfer, not fetus? What do you mean by embryo and fetus? Embryo is going to develop into the fetus, not fetus into develop. The embryo is one, zygote is formed, male and female. Okay, after the zygote, that zygote is going to transfer into the embryo, and from the embryo, fetus will be there. From the fetus, baby will be there. From the baby, child will be there. But this entry is embryo, okay, which is commonly called a test tube baby. That doesn't mean the baby is going to produce a test tube. No, that means fusion of a male gamete and male gamete are going to done like this. Why? Maybe the quality is problem. The fusion is not proper. Sometimes hamper in the motility of the sperm, right? So they take a egg cell and then they take a sperm. They try to fertilize it, okay, outside the body. The ovum from the wife donor, it can be donor as well, not as well. Suppose there's someone wants to be a single parent, right? So they can do this. Ovum from the sperms from the husband or donor are collected and induced to fertilize in laboratory condition. The zygote or a early embryo, zygote and the early zygote को ही क्या बोलते हैं? Early embryo. What is that? S8 blastomas. What is that? I will tell you. When zygote is just formed, it is a single cell. 23 chromosome, 23, 46, one single cell. This zygote will undergo the multiple cells, mass of the cell. These are 8 cells. That is called 8 blastomeres. From 8 blastomeres, 12, then 18, and some cell is going on. So initial cell is what? 8 blastomere cell. Now this blastomere cell is going to divide into another set of cells, and those are dividing upper part, lower part, and the below part of the body. Could be transferred into the fallopian tube. Where? Not in the mother womb directly. They transfer to the fallopian tube. Fallopian tube is also called as the area of fertilization. That is GIFT, zygote intrafallopian transfer. We can't transfer zygote to the directly to the mother womb because implantation is not done yet. Implantation is what? What is implantation? A point at which the zygote is going to attach. But we are going to talk about that in ZIFT. It is transferred to the fallopian tube having the 8 blastomeres, intrauterine transfer into the uterus to complete the further development. That is very, very important over here. Okay, so I want you to write this. Again, let's start about this thing. See, if the 8 blastomere cell is transferred to the fallopian tube, it's called ZIFT, that is zygote intrafallopian transfer. If the same is transferred with a care, proper care to the uterus, okay, it is called IUT, intrauterine transfer into the uterus, complete further development. Yes or no? Okay. Now gift. We done with the ZIFT. Now we're moving forward to the gift one. Just 1 second. See, this is the last part of the chapter, and this is important. In gift, what is happening? Gamete intrafallopian transfer. In gift, zygote was there. What is zygote? A complete combination of fusion is done and then transferred. But right now we are talking about the gift gamete intrafallopian transfer. That means sperm can be directly transferred to the fallopian tube. Yes or no? Okay. Transfer of gamete collected from the donor into the fallopian tube. That means what? From the mother side, everything is proper. And OI is just coming out and they want what? Sperm to fusion, right? Now, listen very carefully now. You can write afterwards, but listen very carefully. Intracytoplasmic sperm injection. What is this now? A specialized procedure to form an embryo in a laboratory in which sperm is directly injected into ovum. In earlier cases, we just try to fuse it, then to introduce into fallopian tube. That is called gift. Sorry, ZIFT. Zygote is transferred, that is ZIFT. If that is transferred into the mother womb, that is uterus, then it is called a IUD. Very good. IUT. And we talk about now what is the problem now? Sperm is not going inside. For fertilization, sperm head to be acrosome should be enter inside, right? Yes or no? But it's not going inside. Then what's going to happen? We are following this process. In a laboratory, intracytoplasmic sperm injection. In injection, there will be a sperm, ova will be there. Obviously, the needle will be very minute. If the ova is there, the sperm has to be entered inside. So egg cell can be fused. So what is the required genetic material from the sperm is required? That is injected inside the ova. That process is called intracytoplasmic. Which whose cytoplasm? Egg cell cytoplasm. Okay. Artificial insemination. What is insemination? Infertility. What is infertility? Not able to produce the sperm, not able to produce the ova. Case in which male partner is unable to produce the healthy sperm. They are producing sperm. They are not healthy means what? They are not motile. First thing is not motile. If they are not motile, they can't go, they can't move. So it will be a problem. That is called healthy, not non-healthy. So are treated by this technique in which semen collected from the donor artificially introduced into the vagina because the sperm is not that much capable to travel a distance, okay, or into the uterus. If directly see what is the introduced semen, directly the sperm. In this case, zygote is there. In case of zip is zygote. Correct? Please pay attention. In artificial insemination, semen, inside the semen there is a sperm directly in vagina. Okay, intrauterine insemination of the female. All these techniques require a extremely high precision handling. How? Because they are very minute. If there is a transportation problem, then definitely it will be create a baby's health problem, right? By specialized professionals are higher, and it is very expensive method because of the instrument. You can't inject a worm directly with your syringe. You need a micro needles, right? Therefore, their benefits are limited to a certain countries and people. Those who are having a lot of money, they also perform this method. Correct? Mostly. Emotional, religious, social factors also prevent the adaptation of this method. If the person is from the village, they will not do anything. They will like, God will give us definitely because they don't have that much money. In a very modified city, they can undergo this process because they are well aware about the science. Yes or no? Okay, so we have completed all the chapter. If you have any doubt, please let me know. So have we covered with the gift and all? Yes, we'll do one quick revision for that. Okay. So we're done with the reproductive health chapter. Okay. So we'll meet in a next session for the further things.